At first, sepsis can look like a normal infection. But the difference is, your child doesn't improve or they start to get worse. Most children who are screened for sepsis are well enough to go home. Though uncommon, sepsis can still develop later, so it's important to keep watching for changes while still at the hospital, as well as after discharge. If you're at home and are concerned that your child is getting worse or new signs and symptoms are appearing, please come back to the emergency department as soon as possible for another medical review.
Sepsis is a serious illness. It happens when the body has an extreme response to infection and harms its own tissues and organs. In the most severe cases, sepsis can lead to death. Sepsis can affect anyone, and any infection can lead to it. That's why it's important to recognise change and treat it early. We want to make sure you understand the potential signs to look out for.
You're watching this because your child has an infection. In some cases, infections can worsen and lead to sepsis. Today, your child has been screened for sepsis, and right now, the team believes sepsis is unlikely. But infections can change. If your child isn't getting better or gets worse, it's important to ask, could it be sepsis? This video will help you recognise the signs and know when to come back to hospital. Before going home, you should receive a paediatric sepsis checklist. There are many signs that may indicate that your child may be getting sicker. These are all described on the paediatric sepsis checklist, which you should have received. Not all of these signs will be present or relevant to what your child has come to hospital for today. The team involved in your care will speak with you about the signs that are most relevant to your child's visit. If you didn't get the checklist or need help understanding it, just ask the doctor, nurse or health worker who is caring for your child today. This checklist can be helpful to monitor your child's condition and can help you to identify if they are getting worse or not getting better. And if your child shows severe signs, like they are working hard to breathe, seizures, drowsy or confused, has a rash that doesn't fade when pressed, has blotchy, blue or pale skin, is floppy, has a lot of pain or is very restless, or has cold skin, call an ambulance on 000 immediately.
You know your child best. Trust your gut and return to hospital. If something feels wrong, ask the question, could it be sepsis?